Hello and welcome to another episode of Dollar Store Surgery. In this video we explain step by step how to simulate a laparoscopic cholecystectomy or camera-assisted gallbladder removal. This immersive simulation challenges students to use their mind and hands to solve difficult medical problems. We also seek to develop an entrepreneurial mindset in our students that identifies product opportunities to make surgery more consistent and effective. A slightly quirky student version of all episodes are available as well. All of the simulation materials you need are listed at the end of each instructor video. Now, surgical motor skills can be developed through exercises like this. Put a nut on a screw by hand, then with surgical clamps, and finally, in the box. Start wearing all of the surgical garb at this early stage so you can get used to it. Next, you'll want to practice surgery by closing a wound on a special type of hot dog that has a casing or a skin on the outside. Bend a needle and thread on some Glide dental floss, which acts just like suture. Make a 1-inch longitudinal cut in the hot dog skin and suture the wound closed. The key in surgery is soft hands, and don't clamp on the eye of the needle or you'll fracture it. Start your work on the hot dog outside of the box. Pierce the near side of the wound and pull the needle all the way through. Tie the suture once to set the knot, twice to lock it, and then cut by turning the scissors 45 degrees so you don't cut the knot too close. Now take things to the next level. Perform the same wound repair inside the box. This box serves as a simple way to simulate a patient's body with, of course, surgical holes in it. The curved needle comes in handy by ideally entering and leaving the tissue right next to the wound. Now, sometimes the needle goes in okay, but comes out too far from the wound on the far side. If you don't like how it's going, no problem. You can always pull back and try again. As before, pull the needle through with those soft hands and bring both ends of the suture outside of the box. Before tying the knot, cut the needle from the suture. The trick to tying the knot inside the box, or patient, is to start by tying it outside of the box. To tie the first knot, grab one end of the suture with your fingers and the other end with the clamps. Gently push the knot in as shown. Tie the second lock knot the same way and cut as before. The last step before moving on is to cover the box with a panel that has a hole in it. Use a camera or cell phone to help do the whole wound closure exercise one last time. Now, all this training brings us to the actual surgery simulation on a fake patient, where the goal is to remove an inflamed gallbladder using a camera to see under the skin. In this case, the gallbladder is a balloon attached to the underside of the liver. Bile is represented by a small amount of water inside the balloon. 2 to 3 surgeons are needed to complete the task. Getting a good camera image is absolutely key to the success of this procedure. Ensure your camera view is oriented so up is up and right is right, or you may be upside down or backwards when you try to coordinate your movements. The first step is to clamp off the supply to the gallbladder. Slightly open a medium-sized paper clip so it looks like the letter V and clamp it down on the balloon neck. Use surgical clamps to grasp the balloon neck adjacent to the paper clip. Then use scissors to make a cut between the paper clip and surgical clamps. The surgical clamps are used to remove the balloon through the surgical hole. Now, one objective of a gallbladder removal is to avoid leaking any of the water during the procedure. So at the end of the case, perform a leak test to see just how well you did. If you're like this group, it will be dry inside.